Hello, welcome to the Fitila Podcast, a space where we share stories, ideas, and solutions that connect local experiences to global change. Here, we believe that every conversation can spark light, guiding us toward new ways of thinking about creativity, personal, community, and national development. I am Ms. Baho El Hamza, host of this podcast. Shamsudden, yes, I'm so excited. It's a pleasure to have you on my podcast today. I think the last time we've met in person was a few months ago in Dawakinkud local government during the OBR campaign Flag Up. You were in the company of His Excellency. I was there to pick up stories for my organization. So it's a pleasure to meet you here today in person.
Thank you.
Yeah, I've been wanting us to have this conversation, but then it's today that Allah so wish that we can have it. There are a lot of things to talk about with you, seated here: health, reading, adventure, your travels experience.
Sounds like a fit.
Culture, even politics, I know. So it will interest you to know that I posted about our meeting today on Facebook, and I requested people to share questions they want to ask you. It turns out that you're a celebrity, even if you're not aware.
Wow. I didn't know that. Okay, bring it on.
All right. So I have a lot of questions from people, and I'm really going to ask their questions. But then to set it on, I'm going to ask my own question, which I know is going to give us a kind of an insight to all the questions. And my question for you first is to tell us a little bit about you. Let us get to know what shaped your life, where you were born, where you grew up, what were the political landscape, etc., etc. What shaped you to who you are here today at Shamsudden?
Yeah, thank you, Ms. Bao. So I think the question about who I am, it's a question that I've been battling with for a number of years now.
Mhm.
And the response has been shaped by my subsequent life experiences in a number of ways. And even this morning, I was speaking with my mom, and then we were going over some key milestones of my own life. And I realized that I haven't been telling that part of my story. And I feel I need to really do a bit more in trying to amplify some of my struggles in life, and also be able to bring out the key lessons that people can learn from them. And we were basically talking about a routine eating schedule in my own family house. And it turned out that there was something that our parents deliberately put in place, and we felt, I personally felt a little bit bad that the kids these days don't have that opportunity. So I feel this is something they are missing. So
what was that in particular?
Yeah, so the schedule of having to have not just 3 square meals as we know it, but 4 square meals.
Wow.
And it has always been consistent, and there is also a lot of wisdom in it.
Mhm.
And also not just the 4 square meals, but also the regimented kind of scheduling in terms of feeding, to say, okay, over the weekends, there are certain kind of food substances that we may want to focus on.
Interesting.
So I never thought about those things, but these days they're beginning to make more sense to me. But back to your question, I was born in Sharada. like a few kilometers from here in Kano Municipal. And that was in the late 70s, to be exact. And I spent some time at a primary school in Sharada. It was called Salanta Primary School as at that time. But now there is a secondary school, junior secondary school embedded on it. But also uh, did my secondary school from junior secondary school to senior secondary school. It's still in Sharada, in a school called GSS Sharada. And after that, I went to Bayer University, Kano, for my first degree, which is a medical degree, degree there. And from there, I went to University of Siena. And Siena is somewhere in
Italy?
Italy, a medieval village in Italy.
Hmm.
And so after that, I came back, but I haven't had chance to go for further studies after that. But at each of these milestones that I mentioned, I will be able to tell you a little bit more.
Okay.
Right from my primary school, when Kano used to be quite light and less dense. Yesterday, I was speaking with someone who happened to be an old neighbor of ours, where I was born. And we were speaking about how the entire area feels busy, that ordinarily during our days, we would assume there was a wedding event going on. But he said, well, that's the new normal now. So the entire street was very busy. And in my days going to from my house to primary school, so we had to pass through a bush. And that bush would require humongous amount of courage for you to go there alone to pass. Yes, and we would trek, and then I remember passing through those vegetations to say, well, this is our life. But nowadays, every step of the way that we followed back in the day made much more sense than what it was as at that time, because everything seems to have changed. And the same way with my secondary school, not far away from my house, but it was a very eventful period because we would trek from our house to the secondary school. And I remember even during my secondary school days, especially when I was attending the junior secondary school, I was also hawking. Yes, so I was hawking some items. So, but discussion about my hawking is an entirely different conversation that I hope one day someone would give me an opportunity to talk about.
So are you the first in your family?
No, I wasn't. I wasn't. So, but I did find myself doing a lot of hawking. I was um, I was selling Wenarogo. I was selling Rake. I was selling Masa. So I was hawking Wenarogo, and I was hawking Masar Bauchi. Yes.
So who was making this Wenarogo and Masa?
Yes. So yeah. So my mom was making Wenarogo for me up until the time I was in JS2, and yeah. So for those solid 2 years from JS1 to JS2, I was hawking Wenarogo. And what happened was at that time, because JS classes only start at around 1 o'clock. So I would have time in the morning to hawk Wenarogo in the same school. The same school.
For the morning attendance?
Yes.
Morning students.
Yes, for the senior students. So I would go hawk Wenarogo. And then by the time it's over the break time, around 11 time, I will start running back home. And then, change my clothes, take my bath, and then come back and with a uniform.
How long does it take you doing this?
You mean from my house to the school?
At what point? I mean, did you reach up to senior section hawking?
Yes. So no, I didn't. So by the time I got to the senior section, I wasn't. I stopped hawking. I stopped hawking not because I didn't like it, but because so the senior section started becoming a bit more demanding. It started becoming a bit more demanding. So I started becoming more conscious about the fact that, okay, I need to be in science class, and this is science class. I needed to, chase certain aspirations that I might have after that I want to have after the secondary school. So that denied me some opportunity to have time to go after the hawking.
How did your mother settle with that? You need to focus on your studies and then drop the hawking.
Yes. So it was not like completely abandoned, but there were some adjustments.
Okay.
So, before I started hawking Wenarogo, I was also busy doing something else. So she was frying akara every day. And one of my major responsibilities was to wake up at 3:30 to 4 a.m. before the first call for Subi prayer, take the beans for processing, and then I will bring it back to my house. And that would happen around 5:30 or 5:20 or thereabout, by the time I would get back home. So by the time I got to secondary school, that was when I now switched gear into hawking Wenarogo, and she was doing less of the akara. So we're doing the Wenarogo, and that gave her more time and also gave me time to go there. And most of the people, so it was just seamless. For me, I would go in the morning, then come back in the afternoon, then take my uniform. So, but by the time I got to S3, I started hawking Masar Bauchi. That was when I started hawking Masar Bauchi.
Why do you call it Masar Bauchi while you made it here?
Yeah, no. Just so that people will understand. Yeah. So, okay. But generally the name is Waina. But in some places, let's say Bauchi, people call it Masa. So, yeah.
So I'm interested to know, a junior secondary school and even senior, was it a mix of boys and girls?
No. It was boys only school.
Would you have done that hawking in that school if there were girls?
I think yes. Let me look at your eyes and say yes.
Okay.
So because so just imagine so some few years ago, so I was speaking with my mom about this. And then I told her something that shocked her.
What did you tell her?
She said, do you know that throughout those years that I was hawking Masa, I was hawking Wenarogo, nobody ever brought it up with me among my classmates. Not even anybody in my street.
And they buy from you too?
Pardon?
They buy from you? They bought from you?
Of course they did. But nobody ever brought it up as an issue, as a topic to even discuss. It was just seamless. Nothing. It was so normalized as at the time that nobody would even talk about it. So it worries me that some of the things, I didn't have time to talk about it at the time, but now I'm getting chances every now and then to speak about it. But nobody ever brought it up with me that, so you are the guy who hoax Wenerogo in our class. Nobody does that. And
You know, it's interesting, Dr. Shamsu, because there are a lot of things people don't know about you. A lot of things about you that people don't know about.
Yeah.
I, for once, of course, don't know about this. I know you're met, right? So yes, because why would I? But you've not spoken about it. And do you know that there were people that said they didn't know that you are a medical doctor until I posted about it. So there are a lot of discoveries today that is awaiting us.
Oh, yes.
And I'm glad to hear that. I felt some connection to that story because,
Oh, yes.
in a way, my life was similar to that. But it's
Oh,
only
yes.
for another day.
Oh, yes.
This is your show, not mine.
Yeah. So somebody
Yes.
somebody said something to me some few weeks ago, and I think he's on YouTube, but one day he's planning to write something about Hawking. So because he's trying to build a theory about people who did hawk during childhood, and then they later, rise up along the social and economic ladder to get somewhere.
Yeah.
He feels it doesn't just happen by chance.
Yeah.
So you always see some greatness in people who have participated in hawking. So he so it sounds so empirical, but he didn't have any
Data.
yeah.
So I hope that person is watching, and there are a lot of us actually
I hope
who
he
hug,
is.
and yeah, and I know there are those who are watching that might like to comment or share their own experience. I think we should have even somebody have a session on how can people who hug.
Absolutely.
That would be interesting, don't you think?
Absolutely. So I think we should have a discussion on hawking,
Absolutely, yeah.
and then also uh, uh, street vendors, because I was vending reke in front of my house. Not again. It has always been at the background. So it wasn't like I would just take Wenarogo in the morning, then come back in the afternoon, go to school, and then come back home and just sleep. No. I used to vend reki right in front of my house. I cut into pieces and put inside the leather and everything. So it has always been an integral part of my life. And but there were also other things that I was hawking even before the Wenerogo. So I was vending kayamia, just normal groceries that women use, condiments, spices.
Yeah.
I was doing that. I recently was telling my son that you see that area where I was born? I have the privilege of knowing every single house in that area. Yeah. I was telling my son, he was shocked. Yeah. And believe you me, so God has given me that chance within my very short life to see people come and go in those houses. I've seen heads of the households gone. I've seen kids born in that house. They grow up, but they have no iota of idea that
Somebody was there.
I was the same person going into their houses to sell spices and condiments, salts, and other things every blessed day. And I would do that every Saturday and Sunday. And that would happen from 2 to around 3 p.m. because I would have to come back quickly and go to Makarantaralo, the Quranic school. So I was always running, against time, trying to beat up, to meet up and be sure that I am either back home to take some deserved rest or back home to catch up with another phase of schooling in my life.
Were you um were you in your were you born and at that point in time, were you in your own family's house?
Yes.
Or you were renting
Yes.
a place?
No. It's always been in our family house.
Is a family
Yes.
house.
Yes.
I'm interested to know that at that point in time, what was one thing what is one thing you can recall that you were so passionate about as a kid at that time?
Yeah. So
Personally, like in your own creative life.
yeah. So I don't know. So I don't know much about so at that moment, I don't know much about whether it was really something I would categorize as my creative life, but I was passionate about a couple of things.
Like what and what?
So I knew when I started growing up in that area, I was passionate about telling stories. I was very passionate about telling stories. In fact, I was being teased about telling stories up to let's say 6 7 years of my life because I had challenges speaking certain words very well. When my brother got admitted into Rumfa College, but first before Rumfa College, he got admitted into Gwale Secondary School. That was maybe 82 or 83. So I was having challenge articulating that because the words were a bit heavy for me. And I wanted to always tell whoever wanted to listen that my brother has just been admitted into Makaranta Gwale. So I would blab some words and then.
Were you speaking in English?
No. I was speaking in Hausa, but I had challenges articulating my words early in life. Yeah, so I would so the school Kanta Gwale would come out
Instead of
yes
Makaranta.
Makaranta Gwale. So and then some people started using that to tease me.
Kantagwale.
Yes, to Kantagwale. They were not calling me Kantagwale, but whenever they would meet me, they would say Bali Makantagwale, something like that. So
It's
one
like-
of them, yeah. So one of them, sadly, is late now.
Yeah.
But he was, may Allah bless his soul. He was up until recently, just like 2 3 years, he would bring it up with me, and then we smile and laugh over it in his probably.
So when do you get
late
when do you
60s.
get the stories you like telling?
No. So it's not just one-sided thing. I loved listening to stories too, but I also yes,
Folktales.
yeah. So what fascinated me about stories was I wanted to always hear the whole gist. So sometimes we would go out with my mom, and it's only these days that these things, would begin to make sense to you. And then we would go with my mom, let's say, to Murtala Specialist Hospital, and for something, and then she would pull me by, to her side, say, "You are just there, busy looking." And my passion was to just have the whole gist, make sure that I have the whole gist, make sure I see the whole picture, so that I can be able to come back
Narrate
and
others
tell
who were not there.
yes, and tell the story.
Interesting.
So telling stories has always been a part of my life. In fact, when I was about to be admitted into medical school, I was even saying in my mind that I don't want to do this. I want to be a journalist. I still want to tell people stories. I still want people to tell people stories, because one of the first most prized possessions in my life was how do I own a radio, because I loved radio, and because that was something that became a huge influence through my dad, because he loved having a radio. My mom, yes, listening to news. My mom had a radio, and it was a big part of our life, our family life. So my mom had a radio. my dad had a radio. I would always want to, you know, be with them, listen to them, Zabarana, Jakarmogori,
Radio
all those kind
Nigeria,
of things.
Kaduna.
Radio Nigeria, Kaduna. I would always want to get the 530 version of Jakarmogori because I didn't want to get to the 1030 version of Jakarmagori for two reasons.
I didn't know that there were even a 1030 version.
Yes, there were two, a repeat version.
By that time, maybe we were
yes,
we were slaves.
Yes. So I never liked
The
those two
1030.
versions. The 1030.
You prefer the
530. But 530 would always come at a very inconvenient time because of Makarantara law. The reason why I preferred the two reasons why I preferred I don't like the 1030 version with Intrusty. Number one, so they would always tell you some bizarre stories. And some of them, in my small mind, some of them might scare me. I might get fixated about them.
Okay.
Something happens, something scary might have happened. So I wouldn't want to be preoccupied in my mind with that. And when I'm passing through our sorrow in my house, I would think, yes, I would imagine those things are passing through the darkness, and that would get me upset.
That is what I think.
Yes. The second thing is that chances are that my dad wouldn't let us.
He would like you to go and sleep.
Yes. So he wouldn't let us, stay that late to listen to the 1030 version. So it's always
a struggle. I know the timing has made sense for you today. Why that version of 1030 is different from the one of 530?
Yes.
I think it's for adults.
Yes. I think so. I think so.
Yeah.
I think so. But it's usually the repeat of the 530, but at least yeah. So you don't. So it saves me those troubles if I avoided the 1030 version. So a bit of a digression, to be honest. So where was I? So I was speaking to you about how I loved storytelling, how radio was a huge component of my life. I actually have a radio right now in my room, so I still have it. And yes, so and that thing. So there are a number of people that I met in my life along the way who also loved radio, who loved storytelling, and they had a huge impact in my life. And I'm incredibly thankful to them for helping me to discover myself, discover my passion, and what have you.
So you were much of oral storyteller at that time because you also listened to stories. But how about reading? Do you read stories at that age?
So yes. So I did read a lot of stories at that age. In fact, when I was in primary school, primary 3 to be exact, I was the only class student at that time that was singled out to be reading stories from books. So I would be asked to come in front of the class to read Iliad and Mekarfi, to read Magana Jari, to read Jikima Gai, so many other books by NNPC. I would be, yes. So I would sit down, and then you would see kids will cycle around me. So I would be seated in front of the blackboard, and then you would see kids moving gradually, and then the teacher would be pushing them back, but they would be moving gradually. Just
they want to immerse themselves.
So yeah, so they want to tap through the gist. They want to tap.
Interesting.
Yeah. So while I loved storytelling, oral storytelling, and also listening, but the reading was a huge part of my life. In fact, I did not stop reading Hausa books of stories until I think somewhere at the end of my junior secondary school. That was when I stopped reading those yes, those stories to people in my class. But then, as life would have it, uh, I am now back telling the same thing. So I'm retracing my footsteps back because I read those stories now to my kids. So I still bring out those books and read those stories.
One thing I want to ask you is something that one of my followers on Facebook asked. How did you discover reading?
Yes, so I think I discovered reading when I started realizing that I could actually read those Hausa books, those NNPC books. So when I started reading them, I realized, oh my God, I can read this. So believe it or not, I never passed through a level where you would give me, let's say, Yau an yi ruwa a Kano. And then I would read it like Yau an yi ru.
You never had that problem?
No, I've never had that problem. So I just discovered that I could just read those books. And I remember very well it started in in primary school 3. I still remember the class. One of these days I I I think I would want to go and sit in that same very seat because I still see that um, place in my mind, that class in my mind. I hope it has not been demolished by some elements, but I still have it in my mind. So sometimes I would sit on the window because those windows of those days that are quite spacious, big, and I would sit on the edge of the window and be reading, and then my friends would take interest, and then they would ask me, "Oh, you know how when kids are bored, so they would just ask me, hey, Shamsu, come and read the stories for us," and then I would sit down. So that was my
that
earliest.
at school or
Yeah, in the school. So that was my earliest recollection of reading, and that was my earliest recollection of influence by books, to be honest. But there was also another influence, uh, which was kind of the bigger influence,
okay?
which was from our dad, because we had our elder brother who is way several years older than us. But my dad would always, pack him with books every day. He kept buying books up until some years uh, when we got into secondary school. My dad would always buy books. He would see books being sold on the street. He would buy it. There was a book that I remember very well that he bought 70 kobo, which I still keep. Sanin ya kamata. And yeah, so those kind of books. So he would have them, and he had this wisdom of it's not every book that he buys that you get to have access to.
Oh wow.
Yeah, so you get to have some certain access to some books. So it's just becoming clear to me now what the wisdom behind that. He didn't want those books destroyed. So there were some quite cherished books. He didn't want anybody to just. So you read them there and leave them
there.
Yeah, that's the rule. So you read and leave them there. And if you read the books, you would get some part at the back that yes, you did well. Nobody would give you money for reading books like the way people do now, but you would be, given a pat at the back that
What
yes,
do you mean?
you did well.
Like people do now? Do you get
Yes.
paid
Yeah,
for
of
reading
course.
books?
Yes. So now people would, let's say, be given chocolate. People would be given,
Oh,
kids would be given
okay.
money, but those days it's about that commendation from parents. It meant a lot to us. It meant a lot, that validation.
Was it? You've told me that you've got exposed to reading Hausa novels and even reading them out to your uh, schoolmates.
Yes.
How about English books? Which one did you discover first?
So I wasn't reading English novels up until the time when I got to secondary school. So we were reading just the normal English textbooks, Mr. Giwa and the rest, and then the writer grammar. Those were the books that we always had as part of our lives.
Curriculum.
Yes, yes, those books that are always embedded within the curriculum. So it's a little bit unfortunate that we no longer have access to those kind of books. But I didn't have access to reading novels up until the time I got to secondary school, when it mattered much more to me, because I realized that I needed to build vocabulary. And for you to be able to build that vocabulary, you need to have access to those books. But because of the influence of the people around me, I also realized that I needed to read magazines and newspapers.
How were the people around you like?
Yeah, so I had people around me, like my brother, who read a lot of novels, but he also read a lot of newspapers. And he kept saying, yes, while these novels can help you, but what really will help you and shape how you learn English is when you stick to listening to the radio versions of English programs, and also reading newspapers, because it helps you see how people articulate points, and those are day to day realities. And I will never forget.
And I think that's still true.
Yes.
Listening to
Yes, absolutely.
people speak
Absolutely,
English to
absolutely.
reading it in the newspaper.
Yes,
But
absolutely.
unfortunately now a lot of us don't read.
Yes, so we no longer do that, and in its place, there's even now podcasts,
Yes.
and not many people actually do. If you meet someone on the street and say, "How many podcasts do you follow on your social media now?" you realize that not many people will have a very positive answer to that, because it's still not the in thing. Before coming here, I was reading something on the social media about the decline in the culture of reading, and also how learning has changed over the years.
Is that by the New Yorker?
Yes, the New Yorker. And my first gut feeling was, yes, I agree with all this.
I saw the title today, but it's going to be my read later.
Yeah. So, but I think the biggest tragedy is that divide between the people whose learning and reading have significantly transformed over the years, and also by the AI, by the internet, and that's on one side, and also the people, let's say, in a place like northern Nigeria, where even having access to good quality education, it's rare. So kids would have to struggle with reading books. So when I finished reading that New Yorker article, and then I came down the street, I saw a lot of kids who ordinarily they would be beaming with knowledge, because I remember at their age, I was beaming with passion for knowledge, passion for reading, but they don't have that opportunity. I have very little opportunities, but they have so much opportunities. But those opportunities have been shielded away from them. They don't have access to the good schools. They don't have access to internet. They don't have access to electricity. I was speaking with you just before we started this podcast about the biggest divide between when a media clip, a video is shared. You see the biggest divide. You see people don't engage with it because they don't have data.
Yeah.
So it's not their fault. It's the situation. So it's not their fault. So you can't even blame them. So while yes, we hear you, New Yorker, with all the changes and transformation, but there is large cohort of people who have no access to even those paper books. They don't have access to them.
This reminds me, how can we inculcate this habit of reading? Because if they lose the basics, I saw an argument from Dr. Shakir the other day on Facebook. He was narrating something he read. I think he had a conversation between some of these tech giants, CEOs. One of them was saying his children need the basics, mathematics, physics, etc. These are what you need. You don't necessarily need all this. You want to build, you want to do coding, then go and learn maths, go and learn physics, for instance. But people now don't care about that. They just want to build, right? They want to build an app. They want to be part of those who are building AI, but they are living the fundamentals. What do you see as we wrestle as a country to join other countries in this AI revolution while we're still lacking in the basics? We don't have quality schools, etc.
Yeah, so I think yeah. So first things first. I think you just can't replace basics because without the basics you just don't get anywhere. Because yeah. So I hear you talking about AI. You know, yeah. So let's unpack this whole concept of access. So it's so the internet access that we talked about, the access to knowledge, as you know it. So it's also akin to healthcare access. So because there are a number of barriers that can impede your access to healthcare services. You might have some barriers that are inherently related to your own social situation, for example, socioeconomic situation. And there are also other barriers that might block your access to good health care on the way. And then there are also some other factors that can impede access at the healthcare facility. If you don't have the right care worker, if you don't have the right equipment, you may not be able to have good access to healthcare. So it's a no-brainer. So uh, this same argument goes to
Education.
The education. I'm not an expert on education, so uh, so bear with me. But it's a no-brainer to say that yes, that logic around access that you can apply to healthcare can also be applied to education. You begin to see that. Yeah, we talk about AI a lot. We talk about the internet, but you don't see you still see our young people struggle with that, as basic as it sounds. So you go on social media, you see them struggling with getting to understand those basics because you have passed through a system that only respected having basics, but the current system doesn't. Yeah, so doesn't recognize and reward having the basics. So that's one thing that
We are
need to-
rushing. We want to join the flow.
Yes, yeah. So you want to be at the party, and you just want to dress up and do your makeup at the party venue. So people don't want to be seen to be going through the rigors of having the basics. So they would always. So just an example, you go and share something on the social media, and say, let's say something of 5 paragraphs, and then somebody would say, can you please explain this? Can you please share this with me on my WhatsApp? Because they want to have it on the go. They do not have the patience. So get me right. I'm not demonizing the younger generation due to their own circumstances. But what I'm saying is that you just can't obviate the need for the basics. Basics is just it's just so important. You just need to have your audience. You can't just go and start reading Risala without going through Kawaidi, Ahlari, Ishmawi. You are likely going to miss the meat of the gist.
Doctor, while we advocate for people to always go back to basics, do not miss the fundamentals, right? You talked about healthcare. Now let's talk about healthcare. Um, you talked about access, that there are a lot of factors that may hinder someone from having good access to healthcare. It could be inherent, could be some social factors. And you somehow brush over the fact that if there are no qualified healthcare workers at the clinic, of course, someone doesn't have access. You consult with non-governmental organization and government even. Um, I work also in this industry.
Yes.
I know how trouble, especially our primary healthcare system is in Nigeria, and especially in northern Nigeria where I work. There's a lot of problem. You go to a clinic in a rural setting. There was a time I asked myself, okay, this categorization of healthcare from tertiary to clinics to health posts, what kind of category of people do we build clinic, health posts, primary healthcare, a general hospital, you know, tertiary like in Kano hospital? What kind of category of people? I didn't find out that it's about the population. It has to do with the population first.
Yes, absolutely.
Right?
So you will also get to the highest level for PSC, which is the primary health care center. And in that primary health care center, you will also have the provisions. However, there is a catch. The catch is this is the national provision. Let's say the national provision says you need to have, in terms of human resource, you need to have one doctor for PSC. And you now realize you are in a state that has shortage of those doctors.
Sorry, doctor. So that our audience would be on the same page with us. Who set the standards? Federal government?
Yes.
Who provide the facilities?
The federal government and the state government. It's always a mix.
Okay.
Because there are some health facilities that are built by the National Primary Health Care Development Agency through multiple other arrangements.
Yes.
But there are also facilities that are built by state governments through also their multiple other arrangements.
Yes.
You find out that you go to certain locations and see a primary health care center that is supposedly built by a lawmaker, a federal lawmaker. So those are usually some constituency projects that used to come down and be built there.
Okay.
But some of the issues we always face is that when those facilities are going to be built, people don't pay attention to those nationally available recommendations.
What kind of attention?
Yeah, they don't pay attention to them. They don't say, okay, so for us to be able to equip a PHC, we need maybe one doctor, let's say 4 tubes or 2 tubes, for example. I'm just giving you a random example. And this project for building the facility would come through, let's say, a lawmaker. And the lawmaker and the contractor and whoever is involved would not say, no, there is need for us to see what is the standard. Can we look at the standard? What is the provision? What is the standard provision for those kind of facilities. Nobody would pay attention to that. That's why you go and realize that some facilities will be built in the wrong location. You would realize that there is a primary health care center built in a place where you have very few number of people.
But it is usually the LGA that gives the fees.
So I'm coming to that also.
Okay.
So that is one gap. So the other gap is that even at state level, you also meet challenges with people not being conversant with those recommendations. So that is where you now see someone at the LGA that is not familiar with the recommendations for the minimum service package. You will see someone at the state level that is also not familiar with the minimum service package recommendations. So it's something that people need to really, especially those working at the PHC level, need to internalize. And to even add another layer of complexity, some states have gone ahead to adapt it to their own context. What do I mean? For example, Kano says, if the national says you need one doctor or two doctors at a PHC, Kano would say, no, we don't think we can afford one doctor at a PHC or two doctors at a PHC. Can we just take one doctor? Maybe the national recommendation says you need two chiefs. Kano would say, we cannot afford two chiefs, but we can afford one. And that's how our budget will also capture that. So that's what happens. So some states don't make the extra effort to adapt the minimum service package to their own context. They would go ahead and say, okay, let's try and see what we can do within our means to just hook, line, and sinker and implement it. And you would always, of course, meet challenges. And if you do an assessment, which is something that usually people should do, you will realize that I can give you an example of what happened in 2019. When in Kano, we did an assessment of all the primary health care centers. We realized that only few of them actually were up to the standard that they could be called a primary health care center. So some of them would be PHCs, but they were actually operating at a health post status. But they didn't know. Even some local governments didn't have PHCs that had a status of a PHC, an entire LGA. So that's something also of a huge concern. So and this is something that it's not a single conversation. It's a continuous conversation that need to be had, going back to what the standards are, what the realistic budget are. As we used to say, we have a PHC budget for Mercedes-Benz, and then we also have PHC budget for Kano.
What do you mean?
Yeah, so the PHC budget for Mercedes-Benz is the PHC budget that has everything tick, everything the standard. While the one for the Kano is based on your fiscal reality, what you can afford, what your annual budget, your annual health budget can afford, what you can be able to say, okay, this is what we can afford. If we cannot afford to have more than one shoe at a health post, maybe that's not what we need. Maybe we don't need to do that. And some states even contemplated saying, okay, looking at all the problems, maybe we don't need to have a health post. Maybe we should not invest in a health post. Maybe we should focus our attention around health clinic and primary health centers. So there are some states, for example, like Kaduna, that have contemplated doing that. They said, okay, let's not waste resources and time on health posts. Every single health post that is available in the state, let's close it down. Let's move all the resources, the little human resources that is there, to health clinic to complement them, and also PHCs.
If we do that, for instance, now there is a reason why we do clinics, PHCs, etc. Like I stated earlier, I think it's because of those people who are there. Now, if you see those who are in those far remote areas, hard to reach areas, where some of them even have to cross by canoe rivers to go to have access to a clinic. If you decide maybe to say we're only going to build a PHC in a certain place, with all the outreaches that you do, etc.,
which will naturally be not be enough.
Yes, that's my concern. Like, what do we do to such kind of people? Because you can't tell people, okay, because we're having clinic here, this is where you should settle. Don't go there and build a house, etc.
Yeah.
People. Another thing is, even those who have PHCs, you would see our general hospitals, being filled up with people and needs.
Yes. So I was talking about building confidence in the population, because you need to build confidence in the population for them to know that yes, I can go and access this primary care, because otherwise they will still jump to the secondary care and even tertiary care. Someone would have simple malaria and may not want to go to the primary health care center near his house because he doesn't have confidence in that. So how do we build confidence in that? And we can only build confidence in people, in them having confidence in the primary health care centers around them, is if we can do so much to those primary health care centers.
Yeah. So where do you think? Last question on this. Why do you think we have some fine policies and documents being developed from various administrations? What is happening? Why do you think it's a problem of implementing such fine, well thought ideas in making better our health facilities?
Yes. So I think for me, for someone who has worked in the space for quite some time, I've come to realize that if we can be able to fix governance, if we can fix governance within the healthcare sector, that you can be able to get a lot of ground in terms of fixing our healthcare system. And governance is a very broad term.
It is.
Because it involves a lot, and that governance has to happen at federal, that's at the national level, and also sub-national level.
You are economical with your response on this.
Absolutely, I can go on. So what I mean is that, for example, if you take the national level, for example, so it's good to have policies, but it's also good to have those policies implemented.
That's my point.
But the biggest way to get those policies implemented is to have the will and the right set of people to implement that. So you realize that in this country, we are more interested in recycling policies rather than implementing them. So policies would always pop up, new policies, but take 5 minutes and critically examine those policies and appraise them. You realize that they are nothing but policies from 20, 30 years ago. But it's just that they now have the tinge of 21st century.
You don't need to answer this question, but do you think we have the right people currently at the federal and state level to achieve such kind of things?
Yes, I don't know why you think I don't need to answer this. I think I would say, so it's not about asking whether the right people are there, but is to generically say we need the right kind of governance. So I am too insignificant to be able to judge whether we have the right people or not, but we need the right kind of governance.
Well, you may see yourself too insignificant, but we know that you are that significant.
Yes.
But that's by the way. Let's talk family planning.
Oh, good.
Should we?
Yes, if you want to. Yes.
I remember when we were in one of our classes during our masters. The population will grow back to about 400 million and will be the third largest country by population on earth. And there is this, intense advocacy on limiting or stopping even giving birds now. People are telling us, I don't know. What do you say to this? For me, it's already happening. You don't need to tell us. How do you see it?
Yeah, but the data is showing us the contrary.
Contrary, how?
Yes. Yeah. So uh, for a state like Kano, for example, so we're still nowhere where we're supposed to be. Because let's speak with the data. So there is a modern contraceptive prevalence, which is barely around 11% or so.
Wow.
Which is quite low for a place like Kano. So we hope that one day we will be able to start talking about uh, 30, 40, 50%.
What you're saying is the acceptance is still low
Yes.
in Kano.
Yes, it's still low. But then there have been a number of improvements because Kano was hovering around single digits up until recently.
Now 11%.
Yes. So that's a success on its own. But then for me, I would say so it's not just about the talk on social media saying kudina haihuwa, kudina haihuwa. I think that's not where our messaging should be. Okay. Our messaging should target the various stakeholders that are critical to family planning. We were at a meeting recently when Malam Ibrahim Khalil raised something very important, okay, which is something that all healthcare workers, all relevant community gatekeepers need to also champion. It's about choices. It's about reproductive choices that people have to make. And so it's not the way it is being, projected that something will now be pushed down your throat, whether you like it or not. So it's about you make the conscious decision as a couple, you and your wife, that you want to limit the number of children. So that is the only way you can be able to make progress. So educate people, enlighten them, make those choices available for them to make. But don't push it down their throat that they must come and take family planning. This is not a COVID outbreak. This is not a COVID pandemic that we now have vaccine that we have to get everyone to come and take the vaccine. Otherwise, you're going to get us infected and we will all die. No, this is about conscious reproductive decision that couples have to make. And that's something that a lot of people tend to miss. And that was what Malam Ibrahim Khalil mentioned in that meeting, that so even religion doesn't force that. And uh, in every country where folks have made significant progress in limiting their childbirth, it's always around people getting the right information and making the conscious decision. If you give people the right information, and don't just give them the right information, otherwise, you will starve them. You starve them in the sense that you give them the right information, they make conscious decision to choose what they want to do, and then you don't have the services. Because family planning is also just like other healthcare services like immunization services, maternal services, because you have to have the commodities, you have to have the people who have the right skill. It's not every person that can just come and give your wife family planning service, or you yourself, because there are family planning services that can be targeted at males. So it's not just as simple as that. It's about a more conscious decision that people make, but also on the other end, you now have those services being available.
So you think it's not about being or disseminating provocative messaging to people on social media to say, based on their economic realities, you need to make this decision whether you like it or not. If not, then there's a danger ahead.
So
Do you think that?
so I don't subscribe to the idea of instilling fear into people. You give people the right information and then they make their choices. And I'm not advocating, get me right, I'm not advocating that we just sit down here and say, okay, if people like, they can just go about. No. So you have to go to their doorsteps, give them the information, follow them with the information, show it to them, because people will not voluntarily seek out that information.
I'm wondering what is the fertility rate of an average Kano woman is, because I'm concerned when you mentioned just 11% contraceptive prevalence rate in Kano.
More than contraceptive prevalence. More than. Yeah.
So is that like, if a Kano woman is supposed to give back to 7 children and then she's not yet receiving this, should we be worried?
So let's get this clear. So let's not confuse fertility rate and contraceptive prevalence rate.
Oh wow, they are
Because
different.
yes, so because we are talking about contraceptive prevalence rate here, where which, for example, has something to do with fertility, but not entirely to do with fertility in real sense, because we are talking about contraceptive prevalence rate. You're actually talking about the level to which women are actually using these modern contraceptive methods, because there are various methods. And if your contraceptive prevalence rate is actually high, it means there are more women and men using those contraceptives in a given location within a cohort of people. So, but fertility rate is simply trying to talk about the number of births that a given woman would have, for example,
in her lifetime.
Yeah, so she might be using family planning methods all her life, but would end up having 3 kids. So you see, it might give you a very wrong picture about family planning. So, but in this case, you want to see high prevalence of contraceptive usage, because you want to see more active users, not just people who have. We have people that we call intenders. So you don't just want to have intenders alone, but you want to have people who actually go
For the service.
out of their way to make that choice. Like I told you, it's a conscious decision to make the choice. A man and a woman, they would say, okay, we want to make a decision about our reproductive choice. We do not want to have a child in the next 5 years, for example. So, but that doesn't affect her fertility in a real sense. Yeah, so
Yeah.
she might end up having 4 or 5 kids in her lifetime, for example. You might, so that's just to clarify that.
Someone asked a question on Facebook regarding this when I requested if they have questions for you. Someone asked, and I will read: why do changes occur during family planning, which mostly affect women's menstrual development? And which family planning method do women in northern Nigerian community tend to adopt? And what are the reasons for preferring these approaches? Two questions. You get them?
Yes. So in general, of course, this is not where we will give a technical advice on the kind of choice to make. But one thing that is important is for each method of family planning, there are a number of considerations that will have to be made. So normally, when you see users having problems with one choice or the other, it's because not much consultation has been made before selecting that choice.
So, first part of his question was, why do changes occur in women when they decide?
Okay. So no, this is very simple.
Question.
This is very simple because these are mostly hormones, and hormones. I don't know how do you call hormones again in Hausa. I can't remember. Maybe before we end the interview, I'll
Can we just say sinadarin jiki?
Sinadarini. So yeah, so hormones sinadarini, and then they tend to alter. Yes, they tend to alter certain situations within your body, how the body functions, whether in a male or a female. So that's why those changes happen.
Like what kind of changes?
Like the changes that could happen around menstrual changes, weight gain, headaches, minor headaches, back pain.
That's expected.
Pain.
Course,
Yes,
right?
of course, those are expected.
So
they're explicitly made clear.
Problem.
Of course, not harmful.
Okay, but as for the preferable method, you advise that person asking these questions to go through.
Absolutely. You don't just begin to take a certain method just because you feel that is what is convenient for you, because the healthcare provider need to evaluate your situation and see whether you can, because there are certain methods that certain people can't have. Let's say if you have a history of heart disease, for example, there are certain methods that you are not allowed to have because they can make the heart disease worse.
Last question on this. I don't know what the data told you, but on the ground where I have been, I have seen family planning or modern contraceptives being accessed by women in rural communities somehow much more than women in the urban centers, those who have access to information, access to the internet, etc. I don't know what if the data told you the same. If it's the same, why do you think that's the case?
So I don't know if I would be able to. I have some data to share with you, but there are some data sets that we may not want to share just with the public for the sensitivity, because not just because it doesn't carry any demographics specifics, but because the chances of that data being misunderstood is very high.
But do you think, does the data talks about differences in access between caregivers in urban centers and caregivers in the rural communities?
Yes, so you tend to see, so despite that assumption,
Yeah,
you still tend to see people using more you tend to see more contraceptive usage in the urban centers, because you assume that there are a lot of people there, and you also have a lot more health facilities that can administer various types of choices. Because if you go rural areas, the more you go deeper into the rural areas, the fewer the amount of the choices that you will find there, because you don't have a lot of healthcare workers in those rural communities that can be able to administer those different choices.
That's fair enough. I know I said that was my last question on this, but this is my last question.
Yes,
I promise. This is just me asking of your opinion. It's something also that is being talked about on social media. Do you think how many kids we decide to give birth to has a relationship with the calamities we see in the community happening, like phone snatching, robbery, banditry, uh, you name it. Do you think?
Yeah, so it's a great question that you ask for an opinion. So and I'm this is not a medical opinion.
Absolutely.
Yeah. Uh, so I think for me, what is more important is how we are able to handle the growing population rather than saying we have too many kids. We sit down and lament about certain things that we may not have total control over.
And this is at the family stage and at the
Exactly.
community stage,
Yes.
at the leadership stage.
Yes, because we have control over at least to a very good degree. We have control over how we train our kids, how we educate them, and we also have some degree of control over how our educational system, that is at governance level, it's managed, and we also have control over how we can be able to educate the different stakeholders with the kind of roles that they will have to play. The Islamic and other religious rulers have their role to play. The politicians have their role to play. Community leaders have their role to play. So I think it's about combination of these, moving pieces to say how do each, body come to the fore to be able to play its own role, rather than sitting down to lament that we have too many kids, that we don't want to have too many kids, that uh, people are just having too many kids. I think that is not the way to go about it.
How do you think? What do you think is? How do you think is the way to go about it?
Yeah, so that's what I just mentioned. So it's about, taking each stakeholder, identifying the roles that they have to play. For example, what is the role of the government? What is the role of the religious leaders? What is the role of the community leaders? What is the role of us as individuals? Because nobody is going to come to train your kid for you, but you just have to do your own part. But also, the community has to play its own part. The government has to play its own part. So it's not about pushing the entire blame to one side, but also making sure that we apportion the roles to where they are supposed to be.
All right. So that's fair enough, Doctor.
Yes.
I think at the last phase of this conversation, I would like to do, to be kind enough to our audience. They've asked questions, as I told you, some of which I've started reading out to you. I would like to read out some questions for you. Some of them we've already responded.
Yes.
For that one, you can just say we've answered that. Those we haven't, then you can respond to. Shall we?
Yes, please.
So this one is from Muhammad Tisho. He said, kindly ask Dr. Sani, where can we get the books he's mostly reviewing at affordable prices in Kano? Since they are not common. What kind of books are not common?
Wow. So
you think we can get them at the cheaper prices in Kano?
I don't know what cheaper price mean. So yes, I don't know what cheaper price mean. So I think you need to one way to get it is have you need to get to be friends with booksellers, a lot of them. They can get you books.
Thank you for this.
Yes, be friends with booksellers. Kano has a lot of booksellers that you don't know. Yes, they are not even on Facebook, many of them. You need to be friends with them. They will get you books.
Can you give us one?
I can.
Please give us.
I will give you. Professor Abdallah Obadamu gave an example of, he recommended Taladi Garba. So when I met Taladi Garba,
in Kaduna or in
Kano, in Tukuntawa here. And Taladi Garba told me, so when I checked with him, even a week later, I realized that I was the only person that contacted him. I was the only person that contacted him. So
people thank Professor Abdullah Obadamu for the recommendation, but nobody reached out.
Nobody reached out.
Okay.
So it was in my second week of contacting him that I think someone else also through me got in touch with him. So when I went to his house, I saw an entire house filled to the brim with books.
In Kano?
Yes, you could imagine. An entire room, not even one room, not two rooms, more than 3 rooms filled to the brim with books.
Is he selling or archiving them?
Selling. So I felt like a kid in a candy shop. I needed to just pick whatever I wanted to pick and buy. So many books.
These are places you usually see maybe abroad.
Yes, so many books.
Interesting. So, okay, this is one.
So many.
Be friends with booksellers. What is another?
Be friends with booksellers, and you can. I assure you, booksellers can get you what you want.
Okay.
Yes.
Thank you. Senator Jani said, "How did you manage to build reading culture, amazing reading culture, despite the fact that your job is time consuming?"
Yeah, I think we've answered this. Yes. Because this started way back before becoming what you termed busy. I don't see myself as very busy, but so it started way back.
People tend to be amazed with how people manage this time.
Yeah, so I think so. Maybe it's because of 2 things.
Okay.
Number one, so I don't have a very big cycle of physical friends. Yeah. So I think that is also helping.
It's very well.
So I don't have a big cycle of physical friends. And also I don't have many, if you like, extracurricular activities. So I kind of, so my family, immediate family, and work, it's virtually what I do. As boring as that may sound.
Right. So the question that was asked about family planning was by Dr. Zaradin Ubali. Thank you so much, Dr. Zaradin Ubali. Mubarak Anwar said, kindly ask him, what has he planned to do with his library after his life?
Oh my God.
I should have asked this question last week.
It's scary.
Yes.
It's scary. What do I plan to do with my books? Is that what he said?
Your library, yes.
Oh, with my library. Wow. Yeah. So this is something that a lot of people, over history, over time, people tend to do. They would say, okay, I think I saw someone on the social media saying he hasn't willed, but it's contemplating where to leave his books.
I think I saw Dr. Musin Ibrahim also today.
Yes, I think maybe that's him. Yeah, so I hope me too, I would be able to come up with what to do with my library. By my immediate family when I'm no longer here. So, but then this is an interesting question because
it touched me too.
Yeah, because this morning, so I went somewhere. I hope they are not watching this. And I saw a family whose head of the family was very instrumental to our learning of the rigors of Islamic teachings right when we were little. And I saw how his house was, shared among the heirs. And I asked what about his books? Because this was something I was asking the family about his books some few months ago. And they said, okay, they will come to the books at a later time when the inheritance rituals are done. But then today I made an inquiry. I said, where are those books? They said, nobody could tell. They're gone. He had piles upon piles of Islamic books. It broke my heart. I didn't even know where to start.
Oh my goodness.
And secondly, I know we don't have enough time. Secondly, few days ago, I was at Hamza Jalal's bookstore, and we were talking about this, where some people left this world with their books now at the hands of their family members, and family members not knowing what to do with them. So people had to start selling them. But if you can sell them, yes, it's fine if you can sell them. But some of them were left in a very bad condition.
Doctor, do you think maybe we can bring an idea of maybe a public library where books like that can be
yes. That is it. So, but it's the choice is
for the inherent.
Yes, for the heirs.
Yeah, for the heirs.
Whether they want to do that or not. I know a lot of people who have donated their families, and what is done in other countries is people tend to, sell them, so you can acquire them. It's yeah. So Emir Muhammad Sanusi II, he acquired the collections of one of the British colonial officers. He had a very Kick-Green, Anthony Kick-Green. So he had a very huge collection of literature around colonial period, things about Nigeria, northern Nigeria, and what have you. And he was so lucky to have gotten those collections.
All right. That was so touching and insightful as well. The teacher Kabir Muhammad asked, okay, he said, tell him I admire him.
Oh dear.
He's well read. He's a well-read person who doesn't select. He read widely and made people like us look lazy.
Oh,
May
thank you.
Allah bless him and his parents.
I mean,
he never gets involved in controversies. Ask him, doesn't he ever get agitated about any of the topics being discussed on Facebook? If he does, why has he never gotten involved?
yeah,
Very interesting.
Yeah, it is interesting. Well, I hope I will never get involved. So, and as you say, controversies are controversies, and the best way to manage controversies is to avoid them, because once you get yourself embroiled in controversies, you begin to, require some additional token. So people will have to come and engage you and say, okay, you need to let your guards down. So that's my principle. So I think the best way to avoid controversy. Yes, you can see things on the social media that will get you really angry and get you agitated, and you feel your priority is not to add your words to it. Yeah, you get more benefit when you observe from a distance. I tend to learn a lot when I observe those social media controversies happening, rather than say, okay, I want to add my words. Because once you add your word to it, then you have taken a side, and you do not want to take a side. You would prioritize learning from that.
But I think there was a time I saw you getting involved indirectly. Something happened.
Okay.
Something was happening. There was a topic that stayed for days.
Wow.
All you did was to drop a title for us, a book title.
Oh.
I can't remember exactly what that was, but then this happened. I remember.
Okay, so maybe what I wanted to do is, so there was a message in that. So I think I wanted people to, maybe what I realized that most of the argument was happening because people were not reading. Maybe that was a message. I'm sure that was a message.
I agree.
Yeah, maybe that was a message.
Muhammad said, which book have you read that truly transformed your thinking, or one he frequently returns to for reflection?
So normally, there are things that I, in my small life as a learner, so there are things that I usually don't think will come up.
Okay.
In terms of questions. So I usually don't think people will come up to me and ask, "Can you give me a list of 10 books that I should read?" Or can you give me a list of 20 books that I must read in my lifetime? Or can you tell me the most life-changing kind of a book? So I hardly give those kind of questions a thought. Maybe that's why I haven't been able to really identify whether there was a book that it's completely life-changing. Because if you read widely and a lot, you will come across so many books that can be life-changing. But I can be able to tell you, let's say, a life-changing book that I've read in 2025, or an amazing book in 2025, 2023, 2024, in that way, or on a monthly basis. You can be able to do that.
A lot of people have asked, you've answered, you responded to in our conversation, you have responded to a lot of questions people ask. They're just getting, they are so amazed with your reading habits. It's all about your reading. But then someone, Lukman Abdul Karim, said, um, please ask him about his fashion firm or fashion company, Premier Garments Nigeria, and how he thinks of the entire industry in Nigeria at the moment. I had to check. I don't know about this. I had to check on that.
Yeah.
My wife today, and we were amazed by what we saw on your social media.
Yeah, so there hasn't been a lot of traction on the social media page.
Yeah, it hasn't been active since.
Yeah, so there are a lot of reasons, but
Operations continue.
yes, we have continued to operate. But one thing that I would like to say is that I think the garment industry in Nigeria has significantly gone forward from the way it used to be, and especially also in the north. But we just need to sanitize it, and sanitize it more.
I think this is my last question by Nazir Halluru. He said, although I think you've answered a part of it, what magic is he doing to combine his busy professional schedules with reading and traveling to explore Africa? We've not talked about your exploration of not just Africa, but the world. Or what can you say about this?
Yeah, so I think that is also has to do with passion. If you read a lot, you are likely going to be able to say you want to also explore the world. So if you have a job that takes you to places, you are likely going to want to explore those opportunities.
Absolutely.
So I'm someone who, let's say, if I'm going to, let's say, Cairo, for example, to work for a meeting, for a 3-day meeting, I would always want to have 1 day or 2 days immediately after to really explore the city. I wouldn't want to do what our people would say, shiga shantin kadangari, just go in, pop, and come out. No. So I would always want to learn a little bit more about it. And I'm also someone who wants to see places, because I believe when you see places, you see different cultures. And when you see different cultures, you see different perspectives about life.
My last question, which is not here, it's about your reviews of book, how succinctly review books in a few paragraphs. Tell me how I can be reviewing books.
Okay. So it's easy. I think if you want to do it, it's very easy.
Okay.
But it will entail you when you read the entire book, and then you now have to come back again to read it if you want to review. Yeah, because unless if you are taking notes, and I don't take notes, so if you don't take notes, you're likely going to miss certain points.
Sure.
So once you read the book, and then you now come back to read it again with the intention of the review. So you have to make sure that in each chapter, you have something to remember. If you can be able to do that, if it's a 7-chapter book, I tell you, remember 1, 2 great points that chapter 1 is talking about, chapter 2 is talking about, chapter 3, in that order. If it's 10 chapters, by the time you put together those 10 chapters in your note app, which is what I use to write my reviews, if I open my note app now, you will see tons of reviews. That's where I usually do the edit and then cut down what I don't want to write, and then there you go.
So many things to talk about with you, Doctor. But then, of course, because of time, we may have to give it to another time. But it's the tradition of the podcast, Fitila Podcast, for us to ask our guests to kindly give us some recommendations, a book,
Wow.
a podcast,
Wow.
and perhaps someone or a page on social media or on the internet you think we should follow for us to learn something. So
Okay.
3 things: a
Wow.
book, a podcast, and perhaps a person or a page that we should follow.
So let me start with a book.
Okay.
So so there are many books, but so let me see which book do I recommend to you now that I would like you to. I would always want to ask people to read 48 Laws of Power.
Wow.
Yes.
Robert Greene.
Yes, because it's important, because you can't just live like that, just this life without thinking about the tricks that people play.
Yeah.
You just can't. So even Islamic scholars would tell us, and they will quote from Quran, that do you think that you are just created like that, just like that? No. So I think it will open. And when you want to read it with your heart. Pour your heart out on it, and read those stories building up to each of the laws. I tell you, you're not going to regret it.
Okay. Right. A podcast.
Afikra.
Afikra.
Yes, Afikra.
Can you spell that?
Afikra.
Afikra.
Yes. Please don't leave this place without checking Afikra.
So what is it?
It's an Arabic word, actually.
Yes.
And so it's about knowledge. It's about you knowing the intellectual and cultural setup of the Arab world in modern days. And it's hugely, loaded with interviews with intellectuals, people who have written books. And I do not want to give you a spoiler. Go and check Afikra.
Thank you.
And Afikra, it's actually an Arabic word. And it's in colloquial Arabic that is used in the Levantine region, that's Lebanon and Syria. When you say Afikra, that's on a second thought. It means on a second thought. So do check Afikra. Okay. So you can get it wherever you get your podcast, as they say in BBC.
That's the language of podcasters.
Yeah, so wherever you get your podcast.
Right,
and they have a very fantastic channel on YouTube. It's
Great.
beautiful.
Great. I wish one day we will be, even if we're not
Yeah,
like them.
Yes, you can be. You can
Inshallah.
be. It will change your thinking,
God willing.
because the anchor is Very good.
Then lastly, maybe someone or a page that you think we should follow online on social media.
So normally I find it difficult to recommend page on social media because I don't know your interests. So, but these days I tell people, so if you don't want to read too much text, find your interests and search for that interest on TikTok. That will help you. Because if you like the infinite scroll to just keep watching, you will be able to see them on TikTok if you don't have all the time in this world to read. But if you do want to read, then go meet your books.
It's
So,
interesting.
but yeah,
It's interesting that you brought about this about TikTok. People thought TikTok is just a place of
no,
nudity,
yeah. So I was telling someone,
immorality.
yeah, I was telling someone.
For me, TikTok is like a school.
Yes,
Honestly
it is a
speaking.
school. Yes. So I was telling someone recently that I have never seen those nudity stuff on my TikTok
So I am. I've
because
never seen any.
I didn't invite them.
Yes, the algorithm goes with what you
It's
like.
very good. Yes.
The kind of searches you make.
Yes.
How long you stay on
Yes.
the video. That's the kind of content it's.
Yeah. So the algorithm in TikTok is top notch
Yeah, I love
because
it. I love it.
once you click that heartbreak,
It
it
means you're
tells them
interested.
yes, it's breaking your heart. You don't want to see it.
They won't show you.
Yes, they
Anything
won't
close
show
that
it to
to
you again. So that's my thing. So if you want to learn English, learn how people put together words. There are people you can follow that are very good, and I tell you, you won't regret following. Let me give you an example of one person. Do you know Pa Ikide?
No.
You don't know Pa Ikide?
No.
You should follow Pa Ikide and see how he comes in as jovial most of the time, but the way he articulates words.
Is it the person that stops people on the road and?
No, it's not a video guy. So it's not a video guy.
But he's on TikTok, you said?
No, he's not on TikTok. He's on Facebook.
Okay.
He might be on TikTok anyway, but I know he's on Twitter. It's a random noise maker.
He don't do videos. He writes.
Yes.
Okay.
He's just a retiree, a noise maker, but the way he articulates things will really humble you. You will learn. After this, I will show you some of the things, or you need to go to his blog and see how he articulated points. You feel it's just a pleasure. It's sweet reading people like him.
Thank you very much, Doctor. It's a
Welcome.
pleasure to have you, and I can't wait to have you again on this show.
Thank you.
I believe this is one of the interesting conversations we've ever had recorded on this podcast. Thank you so much.
Thank you so much.